Good afternoon, and thank you for joining us for the June 9th COVID-19 virtual news conference. My name is Michele. I'm a public information officer working in the Humboldt County Joint Information Center. Let's start by introducing this week's panelists. Public Health Director Michele Stevens, EOC Operations Chief Sofia Pereira, County Health Officer Dr. Ian Hoffman. I'll start today with a brief update from the Joint Information Center. A total of 4,390 Humboldt County residents have tested positive for COVID-19, an increase of 66 cases over the last week. Since last Wednesday's news conference, the county's reported 3 additional COVID-related hospitalizations, and 3 residents of our community have died with COVID. As was noted in yesterday's daily update, 192 local residents have been hospitalized and 46 have died with COVID since the beginning of the pandemic. None of them were vaccinated. For the final time yesterday, CDPH updated tier assignments under the Blueprint for a Safer Economy. Humboldt remains in the orange tier for this final week with a positivity rate of 3.6% and a case rate of 5 per 100,000 residents. Public Health was at Cuddyback School in Carlotta yesterday and is at the Matold Grange vaccinating residents in the Petrolia area today. Public Health also has 2 additional clinics planned tomorrow from 2 to 6 and Sunday from 2 to 5 at the College of the Redwoods Gym. Both will offer the Pfizer and Johnson & Johnson vaccines. Anyone over the age of 12 can receive the Pfizer vaccine at these clinics, and those aged 18 and older can also choose the Johnson & Johnson vaccine. Walk-ins are welcomed at all public health clinics. Those who would like to sign up in advance or view other clinic opportunities can go to myturn.ca.gov. Residents can also visit vaccines.gov to find a local pharmacy that's offering the COVID-19 vaccine. And quick note about the JIC call center. It launched 15 months ago and reached another milestone today, responding to its 50,000th inquiry from the community. That's tens of thousands of calls diverted from 911 and other emergency dispatch systems. And in the last 15 months, call center staff have done a tremendous amount of work to stay up to speed on the latest information about COVID-19. And as always, we are ready for more calls. We'll answer COVID-related questions in English and Spanish. Give us a call at 707-441-5000. Now we'll hear from our panelists who will share an update on what they've been working on before taking questions. Let's start with Michele Stevens.
Hi there, everyone. Michele Stevens. So as you've heard us talking about, we've been planning for demobilizing the Emergency Operations Center and moving to a Department Operations Center through DHHS and Public Health. When we started the response to the pandemic, it was through a Department Operations Center. And so as you scale up in a disaster response, activating your EOC is a common function, and then scaling back down, having your Department Operations Center activated is also a common response. So we've been planning for that. That will be effective on July 1st. The Joint Information Center will continue to operate as well under the DOC with that same phone number of 441-5000 that the public can call. As we've been doing throughout this whole pandemic, we've been scaling up and scaling down with our staffing needs. And so we'll continue to reduce staffing as part of the DOC operations. And more staff will be returning to their home programs or home agencies. Our primary functions for this response continue to be vaccination and our case investigations and testing as well. But primarily it's really getting those cases identified and doing contact tracing quickly to get folks in isolation and quarantine. Those are going to continue to be public health functions in our communicable disease program ongoing. It's just another program function that we have. There are over 80 reportable communicable diseases to a health department that providers have to make, and COVID-19 is one of them. And so we're just planning for this to become our normal day-to-day operations. We've added permanent staffing to our communicable disease program with public health nurses, communicable disease investigators, and other leadership staff. So we're planning this to just become our normal as it has been from here. So that's about it. Thanks.
Thanks, Michele. Sofia?
Good afternoon, everyone. As Mariah and Michele touched on, there's been a lot of moving pieces, and we've been keeping pretty busy here in the EOC as we're transitioning to a Department Operations Center and forging ahead on mobile vaccination clinics throughout the county. As Mariah mentioned, we're in Petrolia today. We'll be at CR tomorrow. Really excited to share that we've been working with True North Organizing Network for a clinic that will be this Sunday at College of the Redwoods. This is to make sure that we're providing a special clinic with Spanish-speaking staff on hand for our Latinx community. So really grateful for their support and working together to get folks in our community vaccinated. So that will be this Sunday, and that clinic is on my turn if folks want to sign up, but walk-ins are always welcome. And so definitely want to encourage folks to come. So with any of our clinics, just know myturn.ca.gov is a place where you can sign up. If you are homebound and you need assistance through the MyTurn website, you can select an option to say that I need assistance in getting a vaccine administered at my house. And the state will follow up and get that information to us so that our homebound vaccination team can get out to you as well. So please know MyTurn is a great resource for finding our clinics, and if you are homebound, getting that assistance. And as always, if you need assistance navigating that website, finding a clinic near you, definitely call the Joint Information Center at 441-5000. Thank you, everyone.
Thanks, Sophia. Dr. Hoffman?
Thanks, everyone. Want to take time today to talk about whole genome sequencing and its importance in the pandemic response. And I'll start with a big milestone here in Humboldt County. Is in the last week, we were able to set up in our public health lab a sequencing machine that is going to start running our own sequencing here in Humboldt County for COVID, and then ongoing we'll have capacity to do other types of sequencing like tuberculosis. And this is really going to help us be more responsive, as right now in this pandemic, but also in the future with other communicable diseases and our ability to respond quickly. It's really impressive that a lab of our size can pull this off. It's been something that they've been working on for a really long time, and really proud of them for pulling this together and the resources that were required to do so. So what does whole genome sequencing mean for our community? Well, we know that throughout the pandemic, we've been able to watch and monitor which variants of concern are here. And I think that's an important public health function, because we can then alert people out in the community what's going on and why we might be seeing certain trends. So, in the month of April, we really saw a dramatic increase in cases, and that was directly in line with an increase in the B117 variant, or the alpha variant, as it's now called. And what we're now seeing is a shift from that alpha variant to another variant, the P1 variant, or the gamma variant. And in the month of May, we've seen a shift of about 50-50, 50% P1, 50% B117. And so we're seeing that trend across the state as well. And I think there could be a shift throughout the month of June to include more P1 variant. And we also have identified one of the B1167, or the Delta variant. And that is a new one to Humboldt County. There have been a few cases across the state, but that one seems to have been contained. We're not seeing evidence that it spread out into the community. It was international travel related, and seems to have stopped. And that was from about a month ago. So we would expect to see more if we were seeing a lot of that circulating in our community. But definitely the P1 is circulating widely in our community. And so why do these matter? Because these variants of concern and variants of interest have the ability to change the way the virus acts in a couple of different ways. It might change the way that it interacts with medications that we use. It might be more transmissible, more highly contagious, Some of them we're monitoring for potential that it could escape through the vaccine response more easily. And then there's also been concern, although we haven't really seen this, but it's still a possibility that it could escape our testing mechanism. So those are all the reasons we're really watching this closely. It's a great thing to have here in Humboldt County, and really excited for that. And great, really great resource we have in the Humboldt County Public Health Lab. Thanks.
Thank you, Dr. Hoffman. Now we'll take questions from reporters. Let's start with Thaddeus Greenson from the North Coast Journal.
Thank you very much. Ms. Pereira, I just wanted to follow up on the clinic on Sunday at College of the Redwoods. I'm curious what you guys and LatinoNet are doing as far as just outreach to that community and making sure that Spanish-speaking residents in Humboldt County are aware that it is taking place.
Yeah, thank you for asking about that clinic. So True North Organizing really has been a lead in engaging directly with folks that they've been organizing with in the Latinx community. So they've done really great, grassroots engagement work. So they're actually doing a lot of direct support and getting folks registered for the clinic, making sure that information is getting out there. So we've been working closely to make sure they have all the information that they need to get folks out to this clinic. And we're just really grateful for their partnership and making it happen, because public health, we need to be working with our community partners if we are going to make sure that as many people get vaccinated in this community.
Excellent. Thank you.
Any other questions about Sunday's clinic or outreach to the Latinx community? All right. Isabella Vanderheiden from the Times Standard.
Hi, thanks for taking my questions. So yesterday, Dr. Hoffman had said that no one locally has been hospitalized or died from COVID after receiving the vaccine. However, in Napa County reported its first COVID-19 death of a fully vaccinated individual earlier this week. According to a report I read, she had caught the Alpha variant. And again, this hasn't happened locally, but can you just address the rarity of hospitalizations and deaths in breakthrough cases?
Yeah. So, want to start off just say no vaccine is 100%. This vaccine is, however, extraordinary in the efficacy. Really, 94, 95% efficacy at preventing severe disease. So that does mean that a small handful of people are going to get sick. And we have seen, and we've talked about the local breakthrough cases here, of which we've been very lucky and not seen any severe ones at all. So none of our local ones have been hospitalized or died. We are monitoring this, nationally and statewide. So Napa is not alone. The state has data on the CDPH website and has done press releases about the number of breakthrough cases who've been hospitalized or died. The vast majority of those are in people who have some sort of immunocompromise or have conditions that predispose them in the first place to severe COVID. And so I think, with time, I'm sure we will see something like that here. It's going to happen everywhere, just like flu happens everywhere every year. And we see cases of people who are vaccinated with the flu get ill and hospitalized and even die sometimes. But the numbers are quite extraordinarily low. I mean, overall, we're looking at 0.03% of folks who are fully vaccinated even getting a breakthrough case. And of those, it's extraordinarily rare for even those folks to get sick enough to get hospitalized or die. So the numbers are overwhelmingly in support of vaccination as a tool and a method to avoid hospitalization and death. Because if you look at our 4,300 cases, 190 plus have been hospitalized, and 40, we're at 46 today, have died. So that's, those numbers are really staggering for that small number of cases. You can imagine if we had as many vaccinated people as we had, or as many cases as we had vaccinated people, that number would be overwhelming.
Thank you very much.
Any other questions on breakthrough cases? All right, Ryan Hudson from the Redheaded Black Belt.
Okay, hi. My questions are basically regarding the dashboard and hospitalization data. So why was the hospitalization data dropped from the dashboard, and what is the benefit to public health and to the public in general of not presenting those hospitalization numbers? Thank you.
Dr. Hoffman, can you speak to removing those metrics? But anyone else, feel free to weigh in.
Yeah, well, we still have hospitalization numbers up weekly. I'm assuming we're talking about the daily ICU and hospitalization that we were reporting back during surge months. You know, the reason we were doing reporting on hospitalizations at that time was we were all very concerned about hospital capacity, and could we get to a point like we were seeing in other parts of the state where we would potentially have an overwhelming surge of cases that our hospital and ICUs would not be able to handle. Once we were past that point, we didn't feel there was a need to continue to report the daily ICU and hospitalization rates. So I think, you know, that's still an important thing for the community to know about. So we do it weekly. You know, if we ever got back to a place, I think it's very unlikely that we would at this point, but if we did, we could certainly reinstitute that daily reporting if our hospitals were really struggling to keep up with the volume that we were seeing.
Okay. Michele, do you have any input on that as well?
Yeah, I was just going to say, you know, given the conversation we were having yesterday at the board meeting with Supervisor Wilson's request to have that, I don't think we anticipated the connection between how many people are vaccinated and the reporting that we're doing on breakthrough cases. And so we were having conversations internally around, in addition to showing the cumulative totals every week, updating the dashboard every week for cumulative totals for hospitalizations, that we could start doing daily reporting in the daily case count news release. Mariah can correct me if I'm wrong on where exactly that's happening, but so that we could show how many hospitalizations are happening from COVID again. Because of the curiosity and the conversations that we're having around people who are vaccinated becoming hospitalized versus people who are unvaccinated becoming hospitalized, and the difference there, and how it really drives the point home of that vaccination works, and that vaccination is going to protect you far more than being unvaccinated or acquiring COVID-19 and having natural immunity. So yes, we're having conversation. I think yesterday's news release included the daily hospitalization, and we're going to continue to do that. We're trying to figure out on the dashboard where to have that data broken down for the week in terms of age groups and that kind of thing. So yes, I think it is an important data point for the community, and that people are curious about that. They want to know who's hospitalized now that so many people are vaccinated.
And
Thank you.
One other thing on that was we are going to look internally at the case rates in the unvaccinated population. That's something our epidemiology team is going to look into as we have, you know, a smaller pool of people who are, you know, unvaccinated, but we're still having fairly high case rates, and almost all of it is in the unvaccinated. You know, when we give the case count per 100,000 of our entire residents, it is a little skewed. So we could look at it as our unvaccinated versus our vaccinated case rates. And so that's something we might be able to report on in the next couple of weeks as our epi team takes a look at that.
Okay. Thank you. That largely answers my follow-up question, which was just, regarding consideration of adding back that hospitalization or ICU capacity data, taking into consideration the unvaccinated versus vaccinated individuals. But the one element to that is how do the variants of concern play into the nuances of that data? If you were to add that back on to the dashboard, would we be able to see which variants are causing people to be hospitalized?
Yeah, it's a great question, and I think I don't think we can't report out on individual cases and which variant they had. We don't release that even to medical providers or patients themselves. It's really more of a public health tool, a research tool. So I think that like what we saw back in April with a large explosion of cases was that we were monitoring and saw that it was closely related to the B117 entering the community. And that very likely had an impact on why we saw a surge in cases locally. So we will continue to monitor that and report out on a more of a public health level. So if we see a concern that we are seeing larger numbers of folks who are, say, getting hospitalized with a certain variant, that's something that the CDC and CDPH help us keep an eye on our data, and they're watching the data nationally and internationally as well.
Thank you.
Can I just piggyback off that too? I think it's important to note that when we list the case count numbers, that's in the real time, right? But when we find out what variants, for example, we're not submitting samples on every single positive case. And so it wouldn't necessarily reflect exactly every single positive and which variant or which strain every single positive case had. And we don't get those results until later. And so reporting after the fact, even if it's a week and a half or 2 weeks later, would be, I don't think, as useful, really. It's more like what Dr. Hoffman was saying, as a public health tool to see what this virus is doing and in that kind of a way.
Thank you. That makes perfect sense to me. Thank you.
Thanks, Ryan. Do other reporters have questions about the dashboard, hospitalization metrics, anything like that?
Yeah, I have a quick follow-up just on the reporting front. We have received questions from a number of readers asking why you guys aren't reporting in real time the vaccinated versus unvaccinated distinction. So in daily case totals, daily hospitalizations, and daily mortality totals, noting what percentage of those are vaccinated, if any. So if you guys could just kind of explain the complexities of reporting that out in real time or why that's not feasible.
Yeah, I mean, we are tracking all that to the best of our ability. Sometimes the data is incomplete. Sometimes we are tracking it down for a week or longer, especially if maybe patients don't have their data, they don't know the date of their vaccination. We're not seeing it in care. We're tracking things down. So it is complex. What we can say though is for sure is that 100% of our hospitalizations and deaths in Humboldt County have been unvaccinated. Of the cases, again, going back to that number, 0.03%, fits pretty well with what we've seen here in Humboldt County. We're not tracking every number. There's already a lot of numbers we're tracking every day. So adding in tracking the exact number of fully vaccinated people who are positive, was decision to just kind of track that more as a general rule of thumb. But I do think that once we can get that case count per 100,000 for the vaccinated population versus the unvaccinated population, that could be a helpful tool that we might be able to update every once in a while to give people a sense of what's going on out there in the community.
Great, thanks.
Any other questions on that topic? All right, we'll go back to you, Thad, if you have any additional questions.
Yeah, I'm curious to ask Dr. Hoffman, when the B117 variant surfaced locally, you talked a bit about the way it was behaving, that you're noticing higher rates of transmissibility, and also that it was making people sicker. Can you speak a little bit along the same lines to what you guys are seeing with the P1 variant now that it's here?
Yeah, I think that it's still a little early to say for sure. You know, the P1 variant, though, does seem to have similar behaviors in transmissibility and, you know, infectiousness. So we really just started getting data on that in the last week or two of seeing a larger number. So going back and kind of analyzing that. You know, when we were seeing the surge when B117 came, it was definitely much more dramatic, and we were tracking quite a large outbreak. So we didn't even know really that that's what was going on. We just had a suspicion that it was one of the variants. So, you know, it's hard to say if that's, you know, not happening with the P1 because the population who's susceptible has just gotten a lot smaller, or maybe the vaccination effort has, you know, reached out far enough. It's hard to say. I think we're going to keep watching it and monitoring it, and you know, if we see concern with the P1 rising, we'll definitely let folks know and put that out through the media.
Okay, thanks.
Thanks, Thad. Isabella from the Time Standard.
Yeah, I actually want to touch on something that Dr. Hoffman talked about yesterday during the supervisor's presentation. Dr. Hoffman, if you could just reiterate some of the Cal-OSHA guidelines, such as, you know, in what circumstances employees are required to mask following the June 15th reopening, and specifically how that, you know, being in an office versus being in close working quarters, and how that will change come July 31st.
Yeah, so Cal-OSHA put out a great press release on this last week, so definitely encourage everyone to go take a look at that. It summarizes it really well. The main points are, well, and I should also say they are meeting again this week, and so we might actually see a revision before the week's over. So stay tuned. But as it's currently written, what they voted on last week was that we, you know, in a workspace where everyone is vaccinated, 100% of the people in that space, physical space, are vaccinated, no one would need to wear a mask. But if one person in that workspace were unvaccinated or vaccination status was unknown, everyone in that workspace would then need to wear a mask. Physical distancing does remain in workspaces until July 31st, after which time it could go away. And the other main, I think, kind of big change for Cal-OSHA is lining up with the quarantine standards that CDPH had revised a while back around being fully vaccinated, which is that if you're fully vaccinated and exposed to COVID, that you no longer would have to be, and you don't have symptoms, that you would no longer have to be excluded from the workplace. So you could, just like we don't quarantine people who are asymptomatic and exposed and fully vaccinated from public health standpoint, they wouldn't need to exclude from work, just monitor for symptoms. So those were the major changes to the Cal-OSHA standards. And I think we'll just keep an eye and see if they keep that, or they might consider some changes to that later this week.
Great, thank you for going over that again.
Thanks, Isabella. Ryan, do you have any additional questions?
Yeah, can I just, I suppose I need to clarify. It was said previously that the county is not tracking the number of residents who tested positive after being vaccinated. I just wanted to confirm if that's still the case, that we're not tracking that. And if you can explain why we're not tracking those numbers.
So we're tracking it. We're not reporting it because the numbers are quite small, and we can't give 100% reliability in them. So we don't want to give false information. But what we can say is they are quite small, and we will continue to gather vaccination data. The state has been, because their numbers are much larger, they have been reporting on those numbers, and I think we'll continue to report on that. I think their plan was monthly intervals to report on breakthrough cases.
Okay, thank you. That actually answers my follow-up too. I was going to ask if you knew what the state number was specifically.
Can't remember off the top of my head, but Mariah, maybe she looks like she might know.
It's on the website. Just go to CDPH's website.
Okay, thank you.
Yeah, it's posted in a press briefing that they put out a couple weeks ago.
Great, thank you.
Thanks, Ryan. Any additional questions for our panelists today?
I do have one more question. So Dr. Hoffman, yesterday at the Board of Supervisors meeting, I think you mentioned that you feel like with epidemiological numbers coming down, we're kind of rounding a curve locally. I'm curious to hear how you feel like June 15th reopening will affect that, and if you are expecting a spike in cases to come in the coming weeks.
Yeah, I mean, I definitely want to emphasize the hopeful part of that. I am hopeful that we are rounding that corner and that the end is getting close. There's no guarantee though. I think behavior of all of us in the county really depends on which way these things will go. So, encouraging vaccination in those who are not vaccinated, giving more and more opportunities for vaccine, continuing to monitor our variants of concern, and encouraging people to continue to follow the guidelines that will be in place once June 15th is there. I think, if people who are unvaccinated wear a mask in public, then I think that we will not likely see a large surge in cases. If people who are unvaccinated choose to go unmasked in public, I think we could very likely see a large surge in cases come June 15th.
If I could just add to that, another leg in this response to the pandemic is getting vaccine for children younger than 12. And so that's still a really vulnerable population. And so that's a whole nother sort of, like I said, a leg to this response in terms of getting to summer and fall and seeing when we can get a vaccine eligible for kids that are younger than 12, so we can add more protection to the community. It's not just adults that we're worried about, right? It would be the kids too.
Excellent. Thank you, guys.
Thanks, Thad. Any additional questions today? All right. Thank you very much to our panelists for being here today, and to you, Isabella, Ryan, and Thad, for joining us. We'll get the recording out as soon as possible. Have a great day.